This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice, one that provides personal, professional, and financial satisfaction.
Welcome to another episode of the Thriving Dentist Show. I'm Gary Takis, your podcast co-host. This episode is titled The Role of a Treatment Coordinator. You know, this is a position that isn't common in practices, but could be a very cool addition to your practice. I think you'll enjoy this episode. Before I get into this episode, two quick announcements to make. Coming up, about 3 weeks after we publish this episode, is our next Thriving Dentist Masterclass. It's Thursday, July 27th. It's a 3-hour course, one evening over 3 hours, 7 to 10 p.m. Eastern Time. And the title of this masterclass is 6 Steps to Successfully Resign from PPO Plans. This has turned into our flagship masterclass. You know, we do a number of different masterclass topics, and this has kind of turned out unintentionally to become our flagship. And in that masterclass, I'm going to literally provide a blueprint for you to successfully resign from PPO plans. So if you're interested in reducing the negative impact of these PPO plans, come join us for this masterclass. I'll literally walk through with you each one of the steps, and it will be a blueprint that you could follow to get great results when it comes to resigning from these PPO plans. The kind of doctors that attend this masterclass kind of fall into 3 different categories. One category would be they've already made the decision. You've said, hey, I've had it with these PPO plans enough, and I just want to learn how to do it with the best result. Well, it's perfect for that. Second category of dentists would be that, you know, they'd really like to resign from PPO, but they're not sure that their practice is ready for this. Also, a good if you're in that category, you'd gain a lot from this masterclass to learn if that can be done successfully in your practice. And then a third group are just curious. You know, they understand the negative impact of PPO plans, but, you know, they're just kind of curious about, is there another model? Well, if you fit any of those 3 categories, come join us. Very inexpensive. Tuition is less than $90. You get 3 hours of CE credits. And more importantly, you'll have a blueprint to follow to successfully reduce insurance dependence. Again, Thursday, July 27th, 7 to 10 p.m. Eastern Time. You can go to thrivingdentist.com/masterclass to register. Hope to see you there. The second announcement that I have is we have a returning guest, Dr. Jared Williams. And Dr. Williams is going to share a wonderful message for you about 3 tips to start your third molar journey. You know, I love Jared's enthusiasm, his passion for his topic, and his passion for helping his colleagues incorporate third molar extractions if that's something you're interested in doing. Hey, without further ado, here's Dr. Jared Williams on 3 tips to start your third molar journey.
Hey, Thriving Dentists. Have you ever started working on a wisdom tooth and thought it was going to be easy, but you found yourself stuck? Well, I'm Dr. Jared Williams. I am a third molar expert, and I just wanted to share with you a couple of tips that have allowed my clinical practice to go smoothly over these last 12 years. All right, let's jump into it. Number 1 is this. One thing I find that a lot of GPs or general dentists typically struggle with is finding the inferior alveolar nerve. Well, if you don't have a CT scan, I want to let you know, be at peace. There's a couple things that you could do in order to find the IN. One, you could track it from the mental nerve and go backwards, or you could track it from the entrance into the mandibular foramen. The next thing I want you to do is this. When you find yourself in trouble, just breathe. The reason why I say just breathe is because there's 3 things that you could do in order to prevent issue to the IN. Number 1 is do nothing. So if your clinical skills aren't up to practice, always do nothing. That's always something I always recommend my GPs that are trained for third molar surgery. The second thing is this. When you take out a tooth and you feel as if you have disturbed the IN, what you simply want to do is just get dexamethasone and the 4 milligram to 1 ml vial and pull out the medication and place it in the socket. You don't have to do any IM injections. All you have to do is take the tooth out and place it in the socket, have the patient bite down on gauze and let them go. That's going to prevent any type of inflammation around the nerve. The last thing that you could do is perform a coronectomy. Now, I wish I knew that tip when I got started. That would have saved me a lot of sleepless nights and thinking that I'm going to get a call from the dental board. But if you apply these 3 techniques to your clinical practice, you won't just be a regular dentist, you'll be a thriving dentist. All right, guys, I'm Dr. Jared Williams, your third molar expert. Make it a great one.
Hello, everyone. Welcome back to the Thriving Dentist Coaching and Action segment. This is Narain, your co-host. Before we jump into the Coaching and Action segment, I want to take a minute to thank Dr. Williams. Dr. Williams, you are very articulate and everything you share is very much appreciated by our community. We got quite a few people writing to us and saying they love your video, so we appreciate you.
And Aaron, it occurred to me that with the video,
Yes.
Jared's kind enough to not only produce his tip in an audio format, but also in video. Where
Right.
can our viewers find the video format?
Yeah, they can just go to the podcast, thrivingdentist.com, find this podcast. And when they look at the show notes, we will put a link so that they can easily watch that video. Also, we'll make sure we upload it to our YouTube channel. So if anybody is interested in video content, we have a Thriving Dentist video YouTube channel. They can find it there as well.
Awesome.
So thank you, Dr. Williams. Today's topic is an awesome topic because, I believe in going on the offense. I'm not a big fan of, imagine this visual, like somebody's punching in your face and either you are the boxer who's punching or you are the one who's like trying to defend yourself. I like to be the one who's going on the offense. I don't want to be like, against the rope and somebody's like pinning me down. So this idea of a treatment coordinator allows you to go on the offense. Let me start with the end in mind. So let's look at Life Smiles, the practice that Gary started. Literally, there are more than 1,000 reviews. And if you just go to the website, go to Google, just type in Life Smiles Dental Care Phoenix reviews, you will see those reviews. And these are what I call love letter reviews. Like they are like writing paragraphs raving about the practice. I would argue, Gary, maybe you can disagree with me. One of the reason this is happening is in Life Smiles, you have a similar role, a treatment coordinator role. So I really want to learn, like, how do you do this? Like, how do you think differently? How do you help patients, choose optimal care as opposed to minimal care, right? So there's lots of nuggets today, and I'm really excited to have this amazing conversation with you.
At Life Smiles, we call that position our new patient coordinator, but is very much modeled after the treatment coordinator role. And I would say, Naren, that that role in the practice is absolutely vital. We have 2 of those individuals in our practice, and I would say, how they contribute to the overall practice is really immeasurable in terms of what they contribute. And I'm really excited to share this information with our listeners. I would say that most dental offices do not have the position of a treatment coordinator in their office. And yet virtually everyone could benefit from that for sure. And the way I'd like you to think about it is this way, Naren. Think about the public. Now, we have to be careful about this because we're so close to dentistry that we know too much. You do, I do, our listeners know too much. Whether you're a dentist or a team member listening to this, we know a lot. We know what dentistry can do for people today. But does the typical, person from the public know all the cool things the dentistry can do for them? Now, there are people that know. There are people that know about cosmetic dentistry and they're deliberately searching for cosmetic dentistry.
Right.
But many times the public doesn't really know. In fact, we know for a fact that a significant portion of the population doesn't go to the dentist at all.
Yes.
More than half don't go to the dentist. And the only time they go to the dentist is when they have a problem, and that certainly, represents, a sizable element in every practice. But the public doesn't really know what dentistry can do for them. And when I think about how the treatment coordinator plays into that, the treatment coordinator helps patients understand all the cool things that dentistry can do for them.
Exactly.
And in particular, the benefits that type of care can provide to the patient. And in essence, they become, that treatment coordinator becomes the guide. Think about the guide. Recently, my wife and I had the opportunity to spend a weekend in Santa Fe, New Mexico. We enjoy Santa Fe an awful lot. We've been there many times. We enjoy visiting Santa Fe. And we decided to do something a little bit different. And we decided to go on a walking tour of Santa Fe. And it was led by a guide. And now we visited many times before. And I thought we knew a lot about Santa Fe. But Naren, there were more things we didn't know about Santa Fe than we did after this 90-minute walking tour. We learned so many new things. And so we can't wait to go back now and experience all the new things that we learned about Santa Fe. Right. And yet, we were kind of veteran Santa Fe travelers. We've been there and we knew about it. But this guide giving the walking tour opened our eyes to things that and we're literally making plans quickly to return because we want to experience those things that we learned about, in the tour. So think about your treatment coordinator as being a guide. And another way I'd like you to think about it, think of that individual as being an advocate for the patient, to help that patient make good decisions about their health. Right. If we go back to the way new patients come into a practice, doctors, I'd like all of you to take a look under a magnifying glass at how a new patient comes into your practice. What is that new patient appointment? What's that new patient experience? Recently, a new client of ours, Naren, shared with me, Gary, I really want to work on my new patient experience. And I said, hey, before I just tell you, how we might evolve that, tell me what you're doing now. And he said, well, because most of our new patients want to have their teeth cleaned, we are bringing them in, through the hygiene department. I'm taking a quick look at them before we provide the hygiene appointment so we can determine their periodontal health. And then we're providing a hygiene service. And then I come in at the end of the appointment to do my part of the new patient appointment. And I asked him, I said, does the doctor part of your new patient exam go on your schedule, as a dedicated appointment time where nothing can go opposite because you can't be in two places at once? I always tell my clients, if you could figure out how to be at two places at once, please tell me, because I want to learn that trick. And it doesn't exist to be in two places at once. So I said, no, Gary, I'm treating it like a hygiene exam. It's not on my schedule. And I said, in the famous words of the TV psychology personality, Dr. Phil, right? How's that working for you? He said, not very well, because I'd like to be spending 20 or 30 minutes with him, but I don't have that amount of time. So if that sounds a little bit like you, or some variation sounds like you, perhaps we need to revisit what your new patient experience is all about. And maybe we can combine topics here and have your new patient experience largely led by your treatment coordinator, You don't have to be the one that does all this. In fact, this team member can be a very cool extension of you.
Actually,
doctor, you can be in the next room doing a crown, and your treatment coordinator can be guiding your patient.
Right. And I think humans are extremely good when you allow them to focus on one thing, right? So when you tell the new patient coordinator, your job is to be the advocate for the patient. Your job is to help the patient discover everything that is possible with regards to their oral health. This person is excited. They love people. They love helping people. They know dentistry, and they know how to communicate dentistry in layman's terms. That's their job. That's their focus, right? That's what they're thinking, as opposed to maybe the dentist, he has to do that. Plus he has to think about clinical stuff. He has to manage the office, or even the dental assistant. They have to help the doctor. They have to make sure all the instruments are ready. There's so many other things. So I really like this name you gave it, Gary, this idea, you almost like giving them a purpose. New patient treatment coordinator. Their job is to,
Let me explain the four things, specific things that are, I'll use the term that we're using in the title, our treatment coordinators do in the first half hour of the appointment. The patient doesn't see the doctor in the first half hour. It's all coordinated by the treatment coordinator. Now, what this person does in our practice is, step one, they take the patient on a quick tour. quick tour. Now, don't get hung up on this. This is not a Disney behind the scenes, open up every cupboard to show every nook and cranny. It's quite literally a 3-minute walk through the practice and highlight some of the reasons that they're going to love being a patient here. Think about it that way. It's 3 minutes. Now it's 4 minutes if the patient's a talker. Right. If they're a talker, it's 4 minutes. If they're not a talker, it's 3 minutes. And what we do is highlight some things they are going to love as a patient of the practice. So
welcome them in.
Yeah, they're going to
introduce them. Yeah, introduce. It's almost like somebody comes to your house. You say, "Hey, so glad you're here. Let me show you around. You know, so here is the washroom. Here is."
And we say we want you to be comfortable while you're here.
Right.
And we, for example, we'll stop. The last stop on this little tour, we stop at one of the photos that we have. It's an after photo. All of the back office at Life Smiles incorporates beautiful after photos, not befores and afters, but just afters of patients that we've helped have the smile of their dreams. Mm-hmm. And so the treatment coordinator will stop at that photo and say, Naren, while we love doing general dentistry here at Life Smiles, our doctors and team also have advanced skills. So we can help people with things like adult orthodontics, cosmetic dentistry, dental implants. And you'll notice photos up here in the office. All of these photos are actual patients of ours that we've helped have the smile of their dreams. So that's the last stop on the tour. Then next, we go into the consult room and we do a new patient interview. And the new patient interview is 7 very specific questions that help us understand the patient's dental history, patient's dental history and patient's dental experience. Every patient will have a dental history and dental experience unless they're 2 years old and it's a happy visit. We do see children. Right. It's a happy ride on the chair. That 2-year-old doesn't have any dental history. So we create the beginning of their dental history by making it an awesome first experience that they have a blast with.
All right.
And hopefully what it does is it sets up a lifetime of positive experience of the dentist. But for everyone else, we want to know their dental history because, you're right about the fact that the TC, the treatment coordinator, needs to have full knowledge of the dentistry that's available in the office. But the other thing they need to do is understand the patient.
Right.
And understand the patient. And so they are really good at getting to know the patient. And you know what they're really good at? And this is a skill that all of us could improve at. They're really good
listening.
At listening. So they're listening they're listening very intentionally. They're getting to know the patient and they're listening. And man, I have to tell you, in so many, you made the comment that Life Smiles has over 1,000
love letter reviews, not just any reviews, like paragraph reviews.
I think why many of them are the love letter type multi-sentence reviews, right, is because maybe it's not common for people to feel listened to.
Right.
In the world. I'm not talking about dental offices, but in the world. It's not common for people. In fact, the more the merry-go-round of life spins faster, I think the less listening is actually occurring.
Right.
But what if we slow down actually get to know our patients? We listen to them. And I think that's one of the reasons why the narrative reviews are so common is because the patients feel heard.
The way I think about it is, think about Ritz-Carlton and any other hotel, right? What's the difference? The rooms are kind of the same. Probably Ritz-Carlton even looks older and dated. But the people, I mean, I guess they have the equivalent of a treatment coordinator, almost like a champion for the guest. They do magic. They make them feel like they're $1,000,000.
We want your visit to be, an amazing experience.
Yeah, exactly.
So the second part of that is we do an interview, 7 questions to learn the patient's dental history and learn more about the patient. Next, we take whatever necessary records that are needed. It could be bite wing x-rays. It could be full mouth series. It could be digital panoramic x-ray. In our case, we have a CBCT. It could be a 3D cone beam image, whatever's needed. And then we finish with taking 6 very specific digital photos. And we take, it's done very quickly. These 6 photos can be taken in less than 3 minutes. And then we'll upload those to a tablet at the end of the doctor part of the exam. and doctor will review those photos with the patient. Now, so that's all done in 30 minutes. And again, those 4 steps are: we do tour, interview, records, and photos, the 6 photos. The 6 photos that we use, by the way, are Dr. Frank Spear's 6 photos for patient education. 6 photos. First one is a natural smile, just smile for me naturally. Second is a close-up retracted view where the patient holds the retractors and we're zooming in very close. The third and fourth we borrowed from our friends the orthodontist: an upper occlusal view and a lower occlusal view. You're not taking a picture of the teeth, you're taking a picture of the flexion of the teeth in the hourglass-shaped mouth mirror. And then the 5th and 6th photos are a right buccal corridor where the patient holds a retractor and you point the camera 45 degrees down the right buccal corridor. And then the 6th one is a left buccal corridor view. Takes 3 minutes to take those photos. Next, we escort the patient into the new patient treatment room. And the timing on this is very important. The patient's in the chair. If you're looking, into the treatment room, the treatment coordinator is to the left of the chair and doctor will come in to the right. We have a dual entry format with the treatment rooms. Doctor will come into the right. And now the treatment coordinator will introduce the patient to the doctor. And in the process of introducing the patient to the doctor, we'll share something with the doctor that has nothing to do with their teeth. Well, nothing to do with dentistry. It has to do with something that they brought up.
Something personal.
Something personal. And it might be, Dr. Paul, George works at Fender Guitar with our patient Maria, and they happen to work in the same department. They work in the quality control department at Fender Guitar. And then doctor will take off on that conversation. Or it might be that Dave loves mountain biking. You're going to have to talk about mountain biking. And they talk about mountain biking. It might be Dr. Tim, Linda has a 6-year-old little boy like you. Oh my gosh, what does your son like to do? And notice what's happening here, Darren.
I think the patient goes from this anxious mindset. Oh, I'm not in I'm in a new place, to relax, because anytime they're thinking about that 6-year-old son, they're in a happy place.
Yeah, this is neuroscience in action. Practical neuroscience in action. We all remember from our high school biology class when we talk about fight or flight or rest and digest. Basically our mind has 2 modes, and one mode is fight or flight, and that's when we see a danger. We have to either fight or flight. Goes back to caveman days when the saber-toothed tiger shows up at the fire pit. Right. But think about it today. With this crazy busy world that we live in, where are most people most of the time subconsciously? Where's their mind? Is it in rest or digest or fight or flight?
Fight or flight. They're looking at their phone and they're distracted and they're like, oh,
they're thinking about all the emails they have to respond to.
Exactly.
Whereas every new patient in a dental practice, every one of them is fight or flight subconsciously.
Yes.
Because it's unfamiliar.
Right. And like you said, the dental story or the experience, there's a good chance they didn't have an amazing experience. Right. So they are like expecting the worst and they're like, oh man, how do I get out of this as quickly as possible? The
other side is rest and digest.
Right.
And where is Bob when he's talking about mountain biking with Paul? His mind instantly switches over to rest and digest, and they're much better. They're able to receive information better. They're comfortable. We've perhaps gone past rapport. Rapport is the early stage of a relationship.
Right.
And we're accelerating right towards relationship here.
Exactly.
And our TCs, our treatment coordinators will tell you, they will flat out tell you, if I don't have something to tee up after a half hour with this patient, if I don't have something to tee up to Dr. Paul or Dr. Tim about them personally, then I haven't done my job.
Right.
And you think about how is that so different? In some cases, doctors, I really want you to step back and look at this objectively because sometimes you're so close to it. In some cases, what the patient feels is you're in their mouth, with your gloves, with your hands, as the first experience they have with you. You're in their mouth.
Right.
And many people feel violated.
Right.
And so you really need to think about a better way, and think about how you could consciously flip the switch in neuroscience, how we could flip the switch from fight or flight to rest and digest.
Right.
And if we start that way, I'm telling you, I think you've gone a long way towards that patient becoming a lifetime patient of yours. They're never going to want to go anywhere else on this. So the TC does all these things. Now, some other characteristics about the TC is it's really good at LifeSmiles at the end of the appointment, after the doctor part of the exam, and then we do a hygiene service of some sort in that first appointment. It'll either be a cleaning or debridement, depending on their periodontal health. And then we finish up at the very end with financial arrangements and scheduling. And in our case, our TCs, the one that started the appointment with the patient, finishes the appointment with the patient, kind of like bookends. Think of it as a bookend experience. And she will finish the appointment with the patient with financial arrangements and scheduling. Right. Their buddy, the one they've become, they've connected with, finishes the appointment with financial arrangements and scheduling. And as a result of that, we see a lot more interest in what I call high value dentistry, what things that we can help the patient achieve. And one of the best outcomes of that TC role in your practice is helping more of your patients take an interest in optimal oral health. It may not be right away, but taking an interest in moving towards optimal oral health. Darren, I took a peek ahead of time and I saw some questions about this, and I think the questions are going to fill in some of the gaps of knowledge here with our listeners. Let's hit pause here on the Coaching in Action segment and get to that Thriving Dentist Q&A.
Welcome back to the Thriving Dentist Q&A segment. Hope you enjoyed that Coaching in Action segment where Gary talked about the role of a treatment coordinator. Let me start with the first of 5 questions, Gary. I'm intrigued by your suggestion of adding a treatment coordinator to my practice. What skills should I look for when I hire for this position?
What a great question. And what I would be looking for more than any tactical skill, they can learn the tactical skills. I'm looking for someone that I would consider to be a strong people person, a strong people person. Now, we use that term. In fact, I think when I say the term people person, I think all of our listeners probably can think of people that come to mind that they consider a people person. Right. But there's a way you can actually test for it. You can find out. And that's that you can use the DISC, the DISC personality styles. It's you've heard me, if you're a regular listener of the Thriving Dentist Show, you've heard me talk about DISC and how it can quite literally be a game changer in your practice. And you can use it in your interviewing process. And the D, I, S, and C, the different personality styles, someone that's a high I, where I is their strongest characteristic, would be an indicator that they have great people skills. They have great people skills. So you can actually, beyond just your own reading of the candidate, you can test for it and you can see if it's there. And if they have stronger eyes, anything above say 60, the bar graph that's measured on the DISC results report goes from 1 to 99. The higher the score on that particular category, the more of that qualities they have. So I'd be looking for something that, say, was above 60 on the DISC. But we're looking for someone that's a people person, someone that is more social, more gregarious, more outgoing, more extroverted, than introvert, more curious. We're looking for curiosity. It'd be nice if they had some dental knowledge. It would be very nice if they had dental knowledge, especially if they knew more about, the high value services that were provided in your practice. Now, you can provide that training. One of our treatment coordinators had no prior dental experience, and we were able to train to that. So you can certainly train to that. But it'd be nice if they knew about dentistry and knew about the kinds of services that were available, how modern dentistry can help people the most. But as far as the tasks go, as far as, taking the x-rays, typically this would be an administrative person, someone on the administrative side, someone on the business side of dentistry. And I would suggest that it's best that administrative person is the one that takes the x-rays rather than passing them off to someone else. because you'll find something will lose in the translation when we pass them off to someone else, where if that person can stay with them and be their connection to the practice throughout that appointment, and bookend the appointment at the beginning and at the end, then that tends to be a better result. But you can teach all that, and taking the photos can be taught. But I'd be mainly looking for the strength of their people skills.
Right. Thank you for that, Gary. Let me ask you question number 2. I love the idea of a treatment coordinator to help patients choose ideal care. How do I attract more patients who are interested in ideal dentistry?
That's a really good question, because one of the things we've talked about in the terms of the treatment coordinator is helping patients discover what's available in dentistry. But you can also attract new patients that are specifically interested in certain things. They're interested in things that you'd like to do more of in your practice, perhaps adult orthodontics, perhaps cosmetic dentistry. Maybe you're a dentist that has gone down a journey to really master complex restorative dentistry. Maybe you've gone through the essentials courses at the Pankey Institute, or you've gone through all of the curriculum in the workshops at Spear Education, or you've gone through the continuum with the Coyce Center up in Seattle, and you want to do more complex restorative dentistry. Then the best way to do that is to really master organic search engine optimization, where you will show up on page 1 for every which way that a patient could be searching for a dentist that provides cosmetic dentistry, or searching for a dentist that has experience in complex restorative dentistry. So it's mastering search engine optimization. Naren, tell our listeners about the marketing strategy meeting that you've made available for our listeners.
Absolutely. So 95% of the practices get no traffic from Google, and that's because Google makes $221 billion a year from those people who don't get free traffic, the 95% that doesn't get free traffic. So to get into the top 5% of Google and get 95% of the free traffic, meaning dominate Google and be found every time for every search term, there are 6 things you have to pay attention to. So in the marketing strategy meeting, we look at how well you are doing in those 6 things. I'm just going to name drop: NAP, Google Lighthouse Go, Google Eat, original content, quality backlinks, and Google reviews. So we literally give you a report card, and our team will spend 6 hours prior to the meeting to really study your competition, and then give you that report card. And then also a plan, like how do you get into the first top 5% in the next.
And this is very analytical. It's not someone's opinion
exactly
about how you get on page 1. It's how you score on Google Analytics.
Exactly. And then part 2 of that is what Dr. Robert Cialdini talks about. Okay, now they know you, they keep seeing you all the time. Why should they choose you? So that's where we implement, we think about the influence principles and how to apply them, like before and afters, videos to humanize you so people like you before they even come in. All those details, we give you a plan and a strategy to kind of dominate those details. So it's no cost. It's a $900 value. And the link is ekwa.com/MSM. So yeah, I think that's a good place to start if you want to attract patients who are looking for these high ideal dentistry situations.
And I'd say any practice that really has a clear, intentional plan to do more of certain types of dentistry, you'd be very well served to master digital marketing in those areas and have people showing up looking for an office that can help them have a gorgeous smile, or whatever that high value service is.
Absolutely. We'll put the link on show notes as well. It's ekwa.com/MSM. Let me ask you question number 3, Gary. I like your concept of combining taking records, a comprehensive doctor exam, and a hygiene appointment for our new patient appointment. But I think 2 hours of that first appointment is too long. Can this be done in an hour and a half?
First of all, doctor, I completely agree with you. I think 2 hours is too long. However, let me tell you what we experienced. We tried to compress that into an hour and a half. We tried. I thought an hour and a half is much more palatable. It's just a half hour, but I thought it'd be much better received to a potential new patient. Okay, I'll do an hour and a half, but I'm not doing 2 hours. And we tried for an entire year. And I'm telling you, we couldn't do it. We tried, and we couldn't do it. And I'll tell you why. It was something that was outside of our control. And that was how the patient, after looking at the photos, would have so many questions. And isn't that what we want, Naren? When the patient looks at the photos and they say, Doc, I don't like this, I don't like that, I don't like that. Can you imagine saying, well, Maria, I'm sorry you don't like that, but I don't have time to talk to you about that today. That doesn't work. We're now wanting to talk to them. We're excited that they're asking questions. And so our experience was that we couldn't do it in 2 hours. Now, if you could, give it a try. We tried for a year and we couldn't do it. And mainly it was because the act of looking at the photos was so useful to the patient. Now they're asking all these questions. And the last thing in the world we wanted to do was throw a wet blanket on their questions. We wanted to answer their questions because they were showing interest in their mouth. So that's what we found. And so if the patient says 2 hours, that seems like a long time. So, Maren, we could break that up into 2 separate appointments, an hour apiece. It's the same 2 hours, but broken up into 2 appointments. The first one would be a records and doctor appointment. And the second one would be the hygiene appointment. And when the patient found out that, it was going to take 2 hours anyway in two separate visits, and by the way, they weren't going to have their teeth cleaned in the first visit, they said, the 2 hours will be fine. So that's our experience with that. And I would encourage you to think about that as you design your new patient journey.
Thank you, Gary. This is a profound episode, Gary. What I mean is we hear from doctors about patients not accepting treatment. We hear from doctors about, patients only doing what's covered by dentistry, right? And then you have Life Smiles on the other end with these new patient, i.e. treatment coordinators. They accept treatment. You're low overhead. Doctors get to do all these wonderful cases and they love you for it. They wrote 1,000 Google reviews. It's not like, they don't want this and you're pushing it down their throat. It's almost like you're helping them get what they want.
Dentistry, I've said, I believe this with every ounce of my DNA, dentistry rocks because we have an opportunity every day to change people's lives. And that could be something we do clinically or it could be something we do behaviorally. And I think the TC role can play to both of those, something we do clinically and something we do behaviorally. The role of the TC, the number one role, is listening to the patient.
Right.
And when people feel heard in 2023 and beyond, it is an exception that doesn't happen very often. Think how much better your practice would be if your new patients felt heard.
Right. Let me ask you question number 4. We take digital photos for our cosmetic cases and our complex restorative cases. However, we are not taking digital photos for our typical new patient. Do you think it would be useful to start taking digital photos for all new patients? If so, what specific photos would you recommend?
Absolutely. I think this would be useful. I mean, I get that you're taking them for cosmetic and complex restorative, but the simple answer and the simple way for you to think about this is we've all heard the saying, a picture is worth 1,000 words.
Yes.
So you can yak all you want, or the patient can look at the photo and they're going to say, I didn't realize my lower teeth were so crowded.
Right.
And the response to that would be, Linda, does that concern you? Well, it sure does now. Now that I see it. That's why you want to take it on all new patients. What specific photos? Frank Spear's 6 photos. The natural smile, number 1, number 2, close-up retractive view, number 3 and 4, upper and lower occlusal views using the hourglass-shaped mouth mirror, and then a right buccal corridor and a left buccal corridor photo. And those are the 5 that I would take.
Thank you, Gary.
Six that I would take. I'm sorry.
Right. Let me ask you question number 5. That's my last question to you. Are you aware of any training resources for a treatment coordinator?
Yes, they're not common. Resources are not common for this because it's not a common position, but I want to recommend one of my wonderful international friends. Her name is Laura Horton, and she is in England. She's in Great Britain. She's in England, and she is the treatment coordinator master. Laura is absolutely delightful. I had the privilege of meeting her in my visits to England. We've lectured at conferences, where she's been a speaker at a conference. I've been a speaker at a conference together. I've gotten to know her. She has online training for treatment coordinator. and I'd highly recommend her resources. And she's got a delightful accent, although she tells me I have an accent. I said, no, Laura, you have an accent. She said, no, Gary, you have the accent. But you'll enjoy her accent. You'll think you're speaking to the Queen of England, and you will absolutely love her. She is delightful in every way. I cannot recommend Laura enough. Just Google Laura Horton, TCO, and that's a shorthand for treatment coordinator, TCO, and you'll find her resources.
Awesome.
But fantastic resource. Darren, as we come to the finish line today, I hope our listeners enjoy this one. This has been a fun one. And you know what? Maybe there's bits and pieces you can immediately apply tomorrow in your practice. Maybe we start taking photos.
Yes.
Maybe we start doing a tour. Maybe we come up with our interview. Or maybe you say, you know what, I like all of this, Gary. I'm going to apply all of this as quickly as I can. But I will say that the presence of a treatment coordinator position in your practice can be a wonderful enhancement in your practice. Well, as we come to the finish line, Darren, I want to thank you for co-hosting this episode. Want to thank your team at Equa for all you do for LifeSmiles, but also all you do for the profession to help dentists attract more ideal patients. Also want to thank our listeners. We appreciate each and every one of you. I have a request. And my request is, if you haven't done it already, hit subscribe. Wherever you get your podcast episodes every Wednesday for the Thriving Dentist Show, hit subscribe. If you hit subscribe, it's free. It simply means that every Wednesday when we upload a new episode, it'll be automatically uploaded for your listening convenience. On that note, let me thank you for the privilege of your time and tell you that Darren and I will look forward to connecting with you on the next Thriving Dentist Show.